And there's a good chance someone you know is suffering from some kind of mental illness. It's a common struggle millions of people are dealing with across the nation. In fact, 1 in 5 Americans will experience mental illness this year.
And that's why Spokane police officers are taking an extra step to help those people suffering. Whenever there's an emergency related to mental health, it's a police officer responding to the scene. So Eastern State Hospital and SPD are bridging the gap with a special program called Cop Talk. Our Mayor Kawash is live in studio with what kind of an impact it's leaving on patients.
Whether it's me, you, an officer on the street, or a person with mental health problems, there's at least one thing we all have in common. We're all humans, and that's the point of this program, to just remember that we're all people first.
I shout right in their face, the same way I'm doing right here.
Mental health isn't easy to talk about. The CDC says about 50% of Americans will be diagnosed with a mental illness at some point in their life. So Spokane police officers are trying to figure out how to help.
It took 4 sheriffs to pin me down to the ground.
Without force.
When I started working out at Eastern, I heard a lot of stories from patients about traumatic detentions or how they were scared of law enforcement.
Carrie Christensen gets a taste of both sides. She's a nurse at Eastern State Mental Hospital and a reserve officer with SPD. She's played an important role in combining the two, so patients and cops can interact just as people. Eastern State Mental Hospital shared these stories and video with us.
As there wasn't a good relationship between the hospital and the police department, there wasn't a lot of communication.
That's where Cop Talk bridges the gap. This new program allows officers and patients at the hospital to learn from each other.
So we'd shoot basketballs, we'd play cards, we would just talk about our lives. And if they asked, well, what do you do? Who are you? I would tell them I'm a police officer. But if they didn't ask, we would just talk.
The officers learn what triggers the patients. Something as simple as the tone they use or calling the person in crisis by their first name can make all the difference.
There may be tension at first. A lot of people come in here with criminal charges, even on the civil side, but they learn. Officer Greg, Officer Dave are just 2 cool guys, just like them, just people getting through life.
About 10% of emergency service calls are related to a mental illness. This program allows each side to remember that a police officer is a human first, just like a person in crisis is human too.
And maybe down the road, somebody's life is saved because they learned how to be arrested properly.
Spokane Police says it's also a goal to have all of its officers trained to handle some kind of situations involving mental health in the future. Live in studio, Mayor Kawash, 4 News Now.